Dr. Djangma Akwetey is a registered medical practitioner with the Medical and Dental Council of Ghana. He obtained his medical degree in 2014 from the University of Ghana Medical School. He has worked in the Upper West Regional Hospital and the Greater Accra Regional Hospital as a medical doctor. He is a former president of the Federation of Ghana Medical Students Association. He was awarded the Mandela Rhodes Scholarship in 2017. Dr. Akwetey is an energetic young man who loves research and has special interest in child health and internal medicine. Dr. Joel is very passionate about changing the complex health system that currently exists in Ghana. He is currently the managing director of People's Health Services, a medical concierge group made of highly skilled medical professionals seeking to provide prompt and efficient medical services to the average Ghanaian. In May of the year 2019, Dr. Djangma granted the African Dream an opportunity to learn more about him.
My name is Joel Djangma Akwetey. I'm a medical doctor by profession. I'm a general practitioner. Currently, I see children, adults, old people, so I do the general stuff. So I studied medicine in the University of Ghana, School of Medicine and Dentistry. Being a doctor or practicing medicine is one of the greatest privileges you can ever have. And I've always seen it as a privilege to practice medicine because you get to help people in the most intricate and delicate ways that you can. And I find it that people would confide in you with all sorts of fears, and because of knowledge you've acquired, you have what it takes for you to be able to impact and bring out some positive outcomes in them. And I think that's a privilege that everyone who gets involved in should see it as, and that's how I see it. I think it's a great privilege. Growing up, I've always wanted to impact health. I've always wanted to do something that would be meaningful to the average person's life, and I find that health is one of the ways, one of the areas that is most ripe for such an adventure, if I should say so. So yes, that's it's always been a personal thing. I used to write stories as young as about me traveling to other countries and doing health missions for people. Yeah, that's why we've started, a few friends and I have started a medical concierge service, which we call the People's Health Service. I mean, after practicing for a few years in Ghana, I've come to see a lot of challenges in our health system. One of it is the bureaucracy and the arduous task people have to go through just to see a medical doctor. Unfortunately, we are seeing more people trying all sorts of alternatives before they come to see a doctor because of how tedious it is to get one. And so we are having more complications from these alternative methods that they try. And so what we are doing to give back is that we've started a medical concierge service where we want people to have that access. We want it to be easily accessible. So we're looking at getting more doctors on board so that when a person is not well, usually the average Ghanaian would go to a pharmacy when they are not well and want to be given a prescription. Why not talk to a doctor first? So we're trying to make it easy so that people can just dial, you know, a short code or some form of number that they can always get advice on their health. Do this and do that, because it's going to have a very positive impact on the kind of cases we see. Right now, most of the time, when you go to the big hospitals, the cases that are referred there are usually very bad cases. And I believe it's because people wander around all kinds of locations, and they usually would come to the hospitals as a last resort. I think it's high time we doctors got involved and got more personal with our patients. What we plan on doing is that we are going also to team up with nurses. We want public education nurses to come on board We are targeting market women because they are the ones who serve the nation. Actually, they're a large majority. The last week I was in Accra, and the number of people there, I kept asking myself, what was their health-seeking attitude? Would they want to go to a hospital first when they're unwell? Majority of them will not, because they want to fend for themselves. So the plan is that we're getting nurses who will go into the community and who are going to give health talks. So it's like we're going to them. So we're going to give health talks. We're going to open that avenue for them to interact. If there are challenges that need to be met, we find a way of meeting it whilst they are there. You know, we want to create that avenue so that even the market woman or the average Ghanaian knows that, okay, if I call this number, they are going to attend to me. I'm going to talk to a doctor. Everybody wants to get the best. It's only about the channels. So one of the ways we are looking at it, apart from the calling in, is that we're also going to put nurses in certain key areas, like the markets, to spread the knowledge on certain very important health topics. Okay, I would want, if it's government or philanthropists, I'd want them to help with funding so that we could employ more nurses to have more impact. So I'm looking at we doing something nationwide. So let's say on Tuesdays across all markets in the country, we're going to be talking about a topic like typhoid, because there's so much. I traveled to Kumasi in a bus from Accra about 2 weeks ago, and the kind of information that's been spewed out from certain sources, it's almost cancerous, because it's going to worsen the situation for us. And we as health professionals who know the right thing, we need to go out there. So I would want it to be something of that sort, where on Tuesdays, we know across the country, we're having information on typhoid fever. We educate them on the symptoms, and Ghanaians would listen if you talk to them. I have noticed that. So we're going to talk to them, we're going to do screenings for them, you know. So for its sustainability of the program, we would also want them to pay a token for some of the screenings so that we can do different things. We're hoping to treat topics like hypertension. So we pick up those who are hypertensive, who need immediate care, instead of doing all sorts of things that would in the end them up with a stroke or a heart disease, because I think we need to intervene. Orthodox medicine has been on the relax for too long. We wait for them to walk in, but I think especially in our part of the world where they haven't gotten that, we need to catch them now. We need to go out and hunt for them and get them. In Ghana, if you want to really do medicine and impact people, you need to get in touch with those people. So we're looking at having a concerted effort. You know, we need to meet up with them and then discuss based on facts. You know, we need to, it's important they don't feel like they're being antagonized, because believe me, they have more people than we do. We think we see people, but I am more than certain that they see more than we do. You know, because we have the laid back approach. They go to the people, you know, and there's their belief that the herbs have less or no side effects as opposed to the orthodox medicine. And so people buy into it more easily. So if we should maybe, like you're saying, I mean, we're looking at doing a partnership with them where we sit and discuss cases. You know, their inputs are also solicited, and then we move forward. I think that bond is a very integral one that would ensure that this program does the necessary thing, or else we will be fighting a very hard war. We need to get them on board, so they could also tell people that, no, look, you go listen, or you go do this, talk to this person, I'll get you a doctor to talk to you before we try this. That's one of the potential areas that People's Health Service is looking at, where we're connecting patients with specialists and they don't need to do all over again, and it's easy. As of now, we do not have that system in Ghana as of now. We need to first of all engage the specialists, and we need to have like an app or a software that we will make available to the specialists. So assuming, I mean, I'm a doctor, so I know a couple of specialists. So if they are all aware of the software, all I do is I give them a call, and then I tell them that, oh, I have a patient I'm referring to you. I'm sending you the details. Please have a look at it, and then we have continued care. Now, they would go there, and then they would confirm the appointment. I let the patient know. The patient goes there, and then the information is already there, and then there's continuation of care. So it's another area that we're looking at, so that the patient under our umbrella can go wherever, and their information just is transferred to the next person who sees and then transfers back, and then we keep it that way. We have a short code as well that is star 711 star 911 hash. Any Ghanaian network, across all the networks. So you dial it, and then you select option 3. That's talk to a doctor. There they're going to ask you to register. So you register, and then you make the request. So you make the request, either you want to talk to a doctor, you want to book an appointment, or you want a home or office visit. You select either options, and then a doctor is going to call you. You're going to make a payment. So you make the payment, and then the doctor calls you and then finds out where you are, and then they come see you. Or if it's talk to a doctor, they tell you what the problem is. We're looking at actually doing partnerships with the pharmacists as well, where we're going to give them a secure line that when patients come in, they want to consult, which most people do, but then because they don't have anybody, they end up giving them what they know. We'll just do that for them, and then we work out something with the pharmacist. So something that we're working at now. So what I want everyone at home, wherever you are, to know is the first thing is your blood pressure. Every average adult should know their average blood pressure. It should be spontaneous to you, so that if your blood pressure is 120/80 on the average, meaning that maybe you've checked it about twice a week or once a week, and you know it's 120/80, and for some reason you're unwell and you check it and it's 180/120, you can confidently say that this blood pressure is not my usual blood pressure. It will save you a lot of headache. The other thing you should know is your sugar level. I mean, you should always check you should do one fasting blood sugar at least a month. One fasting blood sugar. Know your family history as well. Find out from your mother, find out from your father, find out from your uncles whether there's a family history of hypertension and diabetes. These two diseases are non-communicable diseases that are claiming lives. And it doesn't cost anything to know your blood pressure, and it doesn't cost anything to know your sugar level. You should be twice as careful if you have a family history of diabetes or hypertension.